Hi everyone, welcome back. Let's start with a question. A 35-year-old man presents with a painful red swollen lesion on his leg 24 hours after a puncture wound. Physical examination shows that the leg is warm and tender. Which underlying mechanism most directly causes this redness and warmth? So looking through this option, the best answer there will be arteriolar vasodilation. So let's see why. So over the next couple of lectures, I'll be taking us through inflammation. And today we're going to start with overview of inflammation. So by definition, what's inflammation? So it's a protective biological response to tissue with blood vessel leukocytes to harmful stimulus. And this stimulus could be infection, injury, necrosis, foreign body, or immune reactions. And then the goal of inflammation is to, one, eliminate the cause of those injury, two, to remove those dead tissue, and then lastly, to initiate repair. Because without inflammation, we can't eliminate infection, we will not be able to remove all those dead tissue, and repair will not be possible. And the inflammation is terminated when the offending agent is eliminated. So like in the case of infection, when that infection is eliminated, then inflammation is going to be terminated. And there are two main types of inflammation. So one is what we call acute inflammation. So acute inflammation based on the duration usually means 2 days. And we also have chronic inflammation, which is weeks to years. So we're going to start with acute inflammation. So by definition, what's acute inflammation? So acute inflammation is a rapid host response. So like we mentioned earlier, minutes to days, that serves to deliver leukocytes and plasma protein. An example of this plasma protein includes antibody complements, and it's going to deliver them to the site of infection or injury so that it can deal with those infections at that site. And what's our main leukocytes in acute inflammation? So our main leukocytes is neutrophil. So neutrophil is our main white blood cell. And of course, this neutrophil is also called polymorphonuclear leukocytes. So that will be the key player in acute inflammation. And when we look at acute inflammation, the response have two components. We're going to be looking at what happened at the vascular level, so the vascular reaction, and then we're also going to be seeing what happened on the cellular level, because both of them work together to be able to bring about acute inflammation. And both vascular and cellular response, both of them are mediated by what we call chemical mediators. And these chemical mediators, they are substances that initiate, amplify, and regulate inflammation. And I'm going to talk in details about these chemical mediators later. So moving on to the next one. So what are the 5 cardinal signs of acute inflammation? So when I see these cardinal signs, I know that this is acute inflammation. So the first cardinal signs of acute inflammation is what we call rubor, which is redness. So redness is the first sign of acute inflammation. And what's causing this redness? So for instance, let's say this is the blood vessel, right? And as we know, the blood vessel is lined by what? We're going to have our endothelial cells, right? Endothelial cells. So, and let's imagine that there is an injury or there's an infection, there's a bacterial infection in the tissue, right? So, with the first one, which is going to be our vasodilation. So, the release of histamine, nitric oxide, prostaglandin. So, this is going to cause vasodilation, so to dilate the blood vessel. And as we know, with vasodilation is going to lead to decrease in what? Decrease resistance to the flow of blood, right? So the resistance to the flow of blood is going to decrease, and that will lead to what? Increase blood flow, guys. And because of the increase in blood flow to that area, what's that going to lead to? So that will lead to redness. So that will make that area to be red. And then this arteriolar vasodilation is mediated by histamine that is released from the mast cell. Also nitric oxide that can also be produced from these endothelial cells. And then lastly, prostaglandin that could be released from the cell membrane. Remember, the prostaglandin is produced from the arachidonic pathway. And then moving on to the next one. So the next one there is going to be calor, which is heat. So with what we just mentioned earlier, so with vasodilation and an increase in blood flow, so as blood is moving towards the site of injury or where the bacteria is, what happens? The heat is also moving to that area. And of course, increase in metabolism in that area as those cells are wrapping up their metabolism, that will also lead to production of heat. So the calor is due to increased blood flow plus increased local metabolism. And this is also mediated by histamine and a prostaglandin, particularly prostaglandin E2. The next one there is swelling, which is what we call tumor. And this swelling is due to increase post-capillary venous, guys. You have to remember that location is IUD. Post-capillary venous vascular permeability. So, which could be due to contraction of the endothelial cell. So, once you contract or destroy the endothelial cell, or what we call permeability of the capillary, post-venous capillary. So, what's going to happen as a result of that is that those leukocytes inside the blood vessel, they will start to move out of the blood vessel, which is what we call leukocyte extravasation. And as they're moving out, all those plasma protein in the blood vessel, those plasma protein will start to what? They will start to move out of the blood vessel. So they move into the interstitial space. And too much of fluid in the interstitial space is what we call edema, swelling, right? So that will lead to swelling. So as we can see there, so increased post-capillary venous vascular permeability, that leads to plasma leakage, which is what we call exudates, because exudate is a fluid that has a lot of cells and a lot of protein in it. And that will lead to leakage into the interstitial space. And that leads to increased interstitial oncotic pressure. Remember, oncotic pressure is determined by the protein. And what are the key mediators here? So one is histamine, two is bradykinin, 3 is leukotrienes that is produced from the arachidonic pathway. So we have leukotriene LTC4, LTD4, LTE4. And the last one there is platelet activating factor. The next cardinal sign of inflammation is dolor, which is pain. So and what's causing this is sensitization of the nerve endings. And these key mediators here include things like bradykinin, which is the major pain mediator. We have prostaglandin E2 and we have substance P. And these are the key chemical mediators for pain. And then the last one is loss of function. So everything we talk about since, so the pain, the swelling, and the tissue damage, all this could lead to loss of function. And that's the last cardinal sign of inflammation. So in summary, remember, histamine is the earliest mediator of vasodilation and post-capillary venous permeability. Also, bradykinin will cause pain and increase vascular permeability. And a prostaglandin E2 that could cause pain and fever. And a TNF and interleukin-1 that could lead to systemic inflammatory effects like fever, acute phase response, as we're going to see later. So let's now move on to talk about what are the stimuli for acute inflammation. We kind of like alluded to it earlier. So the first one there is infection. So infection is the most common cause of acute inflammation. And this infection could be bacteria, viruses, fungal, parasites. And this triggers inflammation through what we call pathogen-associated molecular pattern. So this pathogen-associated molecular pattern is going to activate the innate immune system. And this pathogen-associated molecular pattern, they are recognized by pattern recognition receptor. Example like toll-like receptor. A classic example is from gram-negative bacteria, they release lipopolysaccharide, right? And this lipopolysaccharide could bind to the toll-like receptor on the leukocytes. And by binding to this toll-like receptor, that's going to activate the cytokine gene, which is NF-kappa beta. And this will lead to release of pro-inflammatory cytokines. And those cytokines are going to bring about inflammation. Next is tissue necrosis. So like cell death, cell injury, like acute myocardial infarction, trauma, bone toxin. All these could lead to acute inflammation. So dead or damaged cells release what we call damage-associated molecular patterns, and this could activate inflammation. Next is physical agents like trauma, thermal injury like heat, cold, or radiation. The next thing that could be a stimuli for acute inflammation is chemical agents. Example like strong acid, bases, environmental toxins, irritating gas, or solvents. Next one there is foreign bodies. So like splinters, sutures, silica, asbestos, cholesterol crystals. So this could lead to acute inflammation. And the last one we have there is immune reaction, like hypersensitivity reaction, like autoimmune disease or allergic reactions. And all this, we're going to talk about them in details. And then we've come to the end of today's lecture, guys. Let's do some questions. So the first question there, a patient with acute appendicitis complains of severe localized pain. Which mediator most directly responsible for stimulating the nociceptor at the site of inflammation? So the best answer there will be very good, bradykinin. Remember, we said that bradykinin and prostaglandin E2, both of them are what mediates pain. The next one there is a 7-year-old child presents with swollen, warm, erythematous knee after a trauma. Joint aspiration reveals protein-rich fluid. Remember, we said that protein-rich fluid are what? Are exudates. What is the primary mechanism responsible for this swelling? So like we mentioned earlier, release of histamine is going to cause endothelial contraction, and by causing endothelial contraction, that opens the space between the endothelia and that allow those protein rich fluid and the leukocyte to leave the blood vessel to go to the site of injury. So the best answer there would be endothelial contraction. Next question, which mediator contributes to both pain and fever during acute inflammation? Remember, we are not only referring to pain here, we also make asking about fever. So the best one there is going to be prostaglandin E2. Remember, as opposed to bradykinin only contribute to pain, not fever. But prostaglandin E2 contribute to both pain and fever. And then remember, prostaglandin E2 is produced from the arachidonic pathway. And that's why if somebody is having fever or pain, what do we give? We give NSAID, right? Like ibuprofen. So, and then what's this medication going to do? They're going to inhibit what? Very good, cyclooxygenase pathway. And by inhibiting cyclooxygenase, that will decrease prostaglandin production, thereby reducing their pain and their fever. Next question. A hospitalized patient develops fever, redness, swelling, and pain at the site of peripheral IV sites. Which finding confirms this acute inflammation rather than chronic inflammation? Like we mentioned, the key player in acute inflammation is neutrophil infiltration, because everything there, macrophage, fibroblast, granuloma, lymphocyte, those are all signs of chronic inflammation, guys. And the last question there, which pair of mediators is most associated with increased vascular permeability? So the best answer there will be histamine and bradykinin. We've come to the end of today's lecture, guys. Please don't forget to like, subscribe, share with your friend, and I will see you guys in the next inflammation lecture. Bye for now.